You've asked, what causes anxiety attack? Could they just suddenly strike anyone? Or are they more of a medical condition that you're born with? In this video, I'm going to answer this question. And at the end, I'm going to answer a deeper question your unconscious mind is asking that you may or may not even realize. And that answer has the power to shift the way you see yourself and your anxiety. Today, we're looking at causes, which will break down into immediate triggers that set off the anxiety and risk factors that make it more likely that someone would struggle with these. I think it's going to be helpful if we talk about anxiety attacks and panic attacks, as there is a fair bit of crossover here. Anxiety can be mild, moderate, or severe. For example, anxiety may be happening in the back of your mind as you go about your day-to-day activities. Anxiety attacks will always be severe, and panic attacks will be even more severe and disruptive. An anxiety attack will typically be related to something identifiable that's stressful or threatening. Panic attacks aren't always cued by obvious stressors, like having a deadline looming at work. Fairly often, they seem to occur out of the blue, and they usually come on very abruptly, whereas anxiety can build gradually. During a panic attack, the body's autonomous fight or flight response takes over, and the physical symptoms are often more noticeable and intense than with non-panic based anxiety, which typically leads to more worries or fears about having another attack. This can affect behavior, leading people to avoid places or situations where they think they might be at risk of a panic attack. Someone may have a panic attack while stuck in traffic and subconsciously fear that being in traffic again will trigger another one, so they avoid driving at peak traffic times or stop driving entirely, and avoidance breeds anxiety. This creates an ongoing cause of panic attacks, but more on that later. Let's have a talk about immediate triggers that set off the anxiety. Panic attacks can be completely unexpected and seem to have no identifiable triggers. But anxiety attacks and panic attacks can be triggered by similar things: a stressful job, driving, social situations, crowded or enclosed spaces like restaurants, cinemas, and churches, heights, reminders or memories of traumatic experiences, symptoms from physical illnesses such as heart disease, diabetes, irritable bowel syndrome, asthma, chronic pain, withdrawal from drugs or alcohol, caffeine, or medications. Just some examples of potential things that can trigger off anxiety and panic attacks. These trigger the anxiety spike in that moment. But what about risk factors that make it more likely that someone would struggle with anxiety or panic attacks? Certain personal factors and experiences that make you more vulnerable to struggling with high anxiety. These are things like experiencing trauma or witnessing traumatic events as a child or as an adult, experiencing stressful life events such as the death of a loved one or a separation, experiencing ongoing stress and worries such as work responsibilities, conflict in your family, or financial difficulties, living with a chronic health condition or life-threatening illness, having a reactive, avoidant, or unadaptive temperament, having close family members who also have anxiety or panic disorders, and the use of drugs or alcohol to avoid unwanted emotions. None of these mean someone will experience a panic or anxiety attack. They only increase one's risk of struggling with these. And I don't want you focusing too much on these, as you can't undo your past to scrub out these risk factors. And you don't need to. Having anxiety or panic attacks doesn't doom you to continuing to have them. Remember earlier how I said we'd come back to ongoing causes of panic attacks? Whenever there's an issue, there'll be thoughts, beliefs, and behaviors that maintain it. If you change those, the issue reduces or stops. Now with panic, beliefs form that certain adrenal sensations like rapid breathing or heart palpitations are signs of danger. We're dying, going crazy, or about to be super embarrassing. The fascinating thing about this as a maintaining factor is that we don't think of looking at internal triggers. So the panic seems out of the blue, totally unpredictable. We look at the situations we're in. No seeming correlation. What we ate, who we're with, doesn't seem to match. Sometimes I panic, sometimes I don't. The triggers are internal. They're sensations. When we're having an issue with panic, the brain becomes hypervigilant to panic symptoms. It keeps an eye out for heart rate and breathing changes, blood pressure and muscular tension, When it notices a shift, an upswing in adrenal activity, it sends a danger signal. Now, unfortunately, this just activates fight and flight and releases more adrenaline, which is called a panic cycle, and why panic attacks get so intense. They're a self-feeding cycle. Address that cycle though, and you sort the panic issue. Anxiety attacks don't work quite the same way. There is a more obvious trigger for these typically, like heights, traffic, or the potential for social rejection. It could be anything really. It's just that the level of the anxiety gets very, very high. So high that it feels like you're being attacked, which is really distressing. And like with the panic, most people try to avoid feeling this way again, but it keeps coming up over and over again. At the beginning, I said there was a deeper question, and it may be conscious or unconscious. Most people struggling with attacks, whether anxiety attacks or panic attacks, are asking themselves, is this just who I am? Or are there things I can do to stop having these attacks? Am I powerless? They feel pretty overwhelming, so it's easy to believe there's nothing we can do about them. But I'll tell you now, there is a process our clients have followed to reduce anxiety and panic attacks. If you're a decider, if you're committed to doing something about your anxiety, you're just not sure what that something is, then keep watching. In my next video, I'll talk about treatment for anxiety attacks and panic attacks, the process that can be followed to move through them. So subscribe, follow, and stay tuned.